basically you see the potency is selected on the basis of which level the patient is coming. We already discussed, the 7 levels: name, fact, feeling, delusion, sensation, energy, and the 7th. So there are 7 levels, and the patient can, present in any of these 7 levels, and depending on that, I would select the potency. So therefore, in that case where 1M was selected, basically the idea was that it was at a level which was level 4, the delusion level. And that's the reason why I selected 1M potency. Let me see if I can pull up a chart for that. So here are the various levels, and if you want, I can go into detail later on if anybody has any question on this. How do you know it is level 1? Pathology. The pathology is the main expression. How do you know it's level 2? Where the local symptoms are the main expression. How do you know it's level 3? Where the emotions and psychosomatic manifestations are the main expression. How do you know it's level 4? Where the dreams and the hormonal and the nervous and the mind symptoms are the main expression. How do you know it is sensation? Where you get the sensation as the main experience. So according to that, we select the potency. If it is level 1, 6C, level 2, 30C, level C, 200C, level 4, 1M, level 5, 10M, level 6, 50M, like that. This is the way in which we select the potency. Now, the question came, why do I repeat it? I don't repeat for 4 days, but 2 days, always 2 days. AD4, BD2 means for 2 days in water, 2 times a day for 2 days. And this way I learned from one of my teachers in Calcutta. His name was B.N. Chakravarti. And he used to, repeat the remedy on 2 consecutive days in water. And when I asked him why he did that, so he said that he found it effective, and he found that, maybe the first time the patient didn't get it properly, or there was something in his mouth. So just to make sure, he used to repeat it over 2 days. And this is exactly the same practice that I followed. And I've been doing it now for, I don't know how many, maybe 15, 20 years or something. I didn't notice any kind of aggravation or adverse effect, but it works for me, it's effective. And this, in olden times in homeopathy, it was called a split dose. That means basically it's like giving 1 dose split over 2 days, So that has been my experience, and that's the reason I do it. No, normally when I give, you see the centesimal potency, it is always 2 times a day for 2 days. And repetition is only done when I want to give the 50 millesimal potency, LM scale of potency. Then I usually give the LM potency once a day for a long period of time. It could be for a month, 2 months, 3 months also. So in a centesimal scale, I normally stay with twice a day for 2 days. But it's suppose in an acute situation, for example, yesterday I had a COVID case admitted in a hospital, and his remedy was bryonia. So I gave bryonia 1M every 6 hourly, and that has helped also. So in an acute case, I feel the need to repeat more often, maybe sometimes 3-4 times a day also. But in a chronic case, when I just want to give a single stimulus, it is only twice a day for 2 days in a centesimal potency.